barriers. I know just from hearing participants that were completing the questionnaire face-to-face, there was often references to, as they're filling out the barriers section, that's just not okay. That's just, you've just got to push through that. You've just got to kind of get there. If you need the treatment, you go. So there's very much sort of those sorts of things coming through, which is interesting. Okay. So overall, we found that in Australia, from the stats that we've got currently available to us, that overall use is stable, but more potent forms are being used, and they're being used more frequently, which I think is explaining some of the recent sort of media focus around amphetamines. Not sure how sort of that matches to the actual situation. That there are many harms associated with use, which is obviously then why we're interested in treating or developing effective treatments for this population. That the combination of cognitive behavioural therapy plus that contingency management component is shown to be the most effective, at least in the literature at this point in time. That online interventions may improve treatment access. We've developed the Beating the Rush program, but however, when we look at barriers to treatment for this population from the perspective of health professionals as well as amphetamine users, and specifically looking around their internet use, their access to the internet and their attitudes towards it, we're finding that that's starting to maybe fill some of the picture a little bit. And I think we kind of skipped that in the literature, that we've kind of gotten excited, we've gone, here's these barriers, I can imagine the internet would be useful, and there's been suggestions around giving it a go. But we gave it a go, and we're like, hang on a minute. And we really did sit around scratching our heads for quite a while, just being like, what is going on? We thought that this would solve things. Geez. But now we're starting to understand that gap a little bit more. We're starting to understand why maybe it